Yeah, that's a great question. So, kind of looking, back, right, historically, for decades, clinical trial protocols have been created as narrative documents, essentially, which is really a legal and scientific contract that was written for human readers, like IRBs, scientists, etc. And so I see it as several structural barriers that have made it difficult up until now. The first being there was no standard data model. And so when you have without a common schema, for example, right, you couldn't build systems that reliably extract that common concepts that's written in protocols by different sponsors, different CROs, which creates a challenge. And so that has changed with the way that what Transcelerate and CDISC has done with building USDM, the USDM model, which has now really changed the landscape of the industry and has created such an important shared vocabulary for the first time. And so I think the second barrier or challenge that we've faced is that clinical language is ambiguous. So for example, you have an activity that is occurring on a schedule approximately every 4 weeks, or conduct as clinically indicated. When you have language like that, it really carries meaning for the physician, but then makes it almost impossible to codify that into rule-based systems. And so historically, previously NLP, right, natural language processing, had a hard time kind of deciphering and understanding that nuance. And then I would say the third layer or barrier to this kind of layered challenges is really the zero error tolerance rate. And so sponsors couldn't trust automation unless it was validated. So you have to have that validation layer as well. And to keep it from, and they'd have to keep doing things manually. And so today, there's this convergence really of, I think, three things that's happening. Now, LLMs can discern or decipher, right, these nuanced languages, the clinical language. We also have the standards, industry standards, that now give that structured output somewhere to go. And also, we have the ability to have this GXP aligned or GXP designed and a validated environment as well. So I think bringing all that together, what is important is that, building that bridge between protocol digitization, digitization of the data, to connecting to those AI agents work streams downstream. And it's really building that connective tissue that ties it all together from beginning to end throughout the entire clinical development lifecycle.